HealthEd is Australia's leading provider of quality clinical education for doctors and other healthcare professionals. This episode has been made available on Spotify and Apple Podcasts. For free access to the full library of podcasts and to claim CPD for listening, visit healthed.com.au or download the HealthEd app.
I will be speaking to Professor Shantha Rajaratnam on sleep, circadian factors, and the impact of light. Professor Rajaratnam, tell us about yourself.
Thank you, David. Great to speak to you today. So I'm a professor of sleep and circadian medicine at Monash University in Melbourne in Australia, and I'm also the head of the School of Psychological Sciences. Within the university, I also lead the Monash Sleep Network, which is a collaboration of research and clinical services in sleep. And at a national level, I also am the chair of the Sleep Health Foundation.
Shantha, we're looking at something right up your alley, really. We're looking at the circadian rhythm and the impact of light on sleep. So why don't I just get you to tell us about the impact of light on our sleep health and the circadian rhythm?
Thanks, David. So look, the first key point to remember is that circadian rhythms have, over the course of evolution, been established within virtually every level of organism to control the timing of our internal activities, physiology, biochemistry, behavior, but also to ensure that these activities and events are synchronized appropriately with the external environment. From an evolutionary perspective, we would expect that these appropriately synchronized activities would give the organism a greater chance of survival. So if we imagine, for example, a key thing would be to ensure that our behavior is appropriately timed relative to when food is available and to avoid times when predators are potentially you're going to be exposed to their presence. And so the circadian system is responsible for the timing of these events within our bodies and synchronized with the external environment. And the way in which we synchronize to the external environment is primarily through light. Now, over the last 50 years, a lot of advances have been made to our understanding of how light influences this circadian system. Now, firstly, just to drill down to what we mean about this circadian system, we know that in the brain, in the hypothalamus, there is a densely packed group of neurons called the suprachiasmatic nuclei. Now, this group of neurons are responsible for generating and maintaining time information within our brains and setting time throughout our bodies. Giving input from the environment to this area of the hypothalamus in the brain is a light pathway through the retina, through a dedicated pathway into the hypothalamus. This is called the retino-hypothalamic tract, and it carries light information to the hypothalamus, to the central circadian clock. And we now understand that light is detected via a novel photoreceptor system that's different to the way we use light to support our vision. And this is important because it means that the circadian system has a light input pathway that is complementary to the light input pathway to the visual system. And there are specific characteristics of light that become important for the circadian light input pathway. But happy to tell you more about that, Dave.
Very interesting. I would love to, because I'm beginning to think, Shantha, that we have diseases that affect the visual pathway systems, and I wonder whether we have defects or issues that might affect this other system. But we'll go on to your story. This is most interesting.
So, David, the circadian system, because its fundamental function is to dictate time and keep multiple physiological systems appropriately synchronized with one another and with the external environment, there are multiple situations in which disruption of this circadian system can give rise to clinical manifestations. So a good example is certain types of sleep disorder. Now, we know there are many types of sleep disorder that have been described. Over 90 sleep disorders have been described. But there are a group of them that are caused by disruption of the circadian system. And these largely are characterized by disruption in the timing mechanisms of sleep, because we know that the sleep and wake cycle is one of those behaviors that are regulated by the circadian system. That's why we have a particular time of the day when we're programmed to sleep and a particular time of day that we're programmed to be awake. When that system is disrupted in some way, the timing of sleep becomes altered. Now, sometimes this is internally driven. So there are certain types of sleep disorder, for example, delayed sleep-wake phase disorder, which is a chronic sleep disorder that is caused by abnormally delayed or later timing of the circadian clock, which causes abnormal timing of sleep to a much later time. It's much more common in adolescents than in older people. But there are also certain types of circadian rhythm disruptions that are externally imposed. So a classic one of those is when we travel rapidly across time zones. When we move across time zones, what we're doing is our circadian clock, which is adapted to one time zone because of the light and dark information it's receiving in the local time zone. If you travel across time zones, for example, from Melbourne to London, you're suddenly exposed to new light cues and you want to impose a new sleep-wake cycle. And the circadian system has to adjust to that new light-dark and sleep-wake cycle. That takes several days typically. And during that time, there is internal disruption of this system. And that causes a number of symptoms, such as sleep complaints, the person feeling excessively sleepy while they're trying to remain awake, but also gastrointestinal disturbances are commonly reported. Mood disturbances are commonly reported. And it shows that this kind of timing information that's programmed by the circadian system is critically important for multiple areas of our mental and physical functioning.
Just while we're on this subject, because light is such an important cue, if you like, to our hypothalamus, what happens if you always wear very dark sunglasses? Does it affect it at all?
So, firstly, there are marked differences in people's sensitivity to light. So some people's circadian systems are much more sensitive to light than other people's.
Okay.
So firstly, the question of whether if you wear sunglasses all the time, some people are going to be, because you're filtering out light input, some people are going to be much more affected than others because some people are much more sensitive to light, so the light they receive may be adequate even through sunglasses. However, I would say that in general, we as human beings have been programmed to have light exposure, outdoor light exposure for a particular period of the day, which is important in not only regulating our internal circadian rhythms, but also for promoting mood, cognitive function, and probably many other physiological functions as well. So I would say that the risks posed by wearing sunglasses all the time and minimizing light exposure is that there may be inadequate light exposure for the circadian system to align itself well or synchronize well to the environment. But there's also a reduction in the light input to our systems that support our cognition, our mood, and other areas of functioning. And that's a similar problem that arises when people spend a long period of time indoors without good light exposure as well. It's a similar problem that arises.
You know, I just really appreciate this because what you're really saying is that if we just stay indoors and miss out going out, not just for a walk, we are really setting ourselves up for a lot of issues, not just sleep, but it's going to affect our mood and our cognitive function as well.
So, David, it's really interesting that we as a society, after millions of years of evolution, have reached the point where our scientific knowledge now has kind of caught up with what ancient communities, of course, were practicing for generations and millennia in many cases. And that is that appropriate relationships between the organism and the external environment, living in sync with the environment, is critically important for our health. And we as humans have come to realize that. And so we're now talking about concepts like adequate exposure to outdoor light being important for mood, cognitive function. We've talked about how maybe light exposure might be an important component when we're talking about exposure to green spaces, that light exposure might be an important ingredient of that effect on your well-being. And so it's interesting that we've finally caught up with our understanding of the neurobiology, the neuroscience of what is going on with what ancient communities have been practicing for millennia.
Shantha, that also brings to mind the kind of colors that we look at, because when we go for a walk, if you like, the two predominant colors in a non-built-up environment would be the green of trees and grasses and the blues of skies and water. Is there a particular reason why these colors exist, and do they actually have a greater impact on us?
So, David, it's a great question. And when this particular photoreceptor system was first described and defined about, 25-ish years ago in humans, it was found that the circadian system's photoreceptor mechanisms are maximally sensitive to shorter wavelength light in the kind of the blue range. So the blue color range appears to be what our system is most sensitive to. It doesn't mean that light in the longer wavelength range, green and so on, our system is not sensitive to, but these photoreceptors called the melanopsin-containing intrinsically photosensitive retinal ganglion cells are most sensitive to short wavelength light. So that means that our system is most tuned to receiving this kind of blue light in the blue light range. And that has led, that knowledge in photobiology and neuroscience has led to a proliferation of devices, for example, that artificial light devices that have enhanced short wavelength composition. So that is more blue in the light source. And of course, LEDs have allowed us to be able to manipulate the light composition of light sources much more easily than we previously have been able to do. And it means that now we can manipulate the indoor lighting environment much more effectively to optimize human health. So now architects, lighting designers are becoming really interested in this space because they know now that we can design lights to enhance in particular colors for particular times of the day when we want to promote alertness, promote cognition, enhance mood, and then certain times of the day we want to promote sleep. We would change the light color composition for that purpose.
Now, I'm really looking forward to a time when, in fact, these sorts of thinking gets introduced into the building of new houses.
Absolutely, David. And there is a growing movement whereby we have been talking about enhancing the power of light, but also protecting against the harmful effects of light. And that movement is being informed by evidence on the opportunities that we have in, that we've, through our discoveries of the properties of light that affects this circadian system and affects our biology, but also the studies that have documented the harmful effects of light at inappropriate times of the day, for example, like light pollution or indoor lighting at times of the day when our system is highly sensitive to light and is disrupted by light. So you're absolutely right. I'm looking forward to a time when we will have indoor spaces, homes, workplaces, retail places, care settings, where there will be strong attention paid to how do you design the light environment to optimize human health, more than aesthetics and more than visual acuity. It's also to make sure that the lighting is optimal for human health, largely mediated through this circadian timing system we're talking about.
Now, taking it one step further, because you mentioned that a lot of our internal processes and its timing and its processes are linked. Are we seeing more of our modern day diseases? I'm talking about metabolic diseases and what have you. And also, if you like, neurodegenerative processes, can they be impacted upon by this change in our exposure to light, if you like, the abnormal exposure to light?
So I would go, David, one step back from that and say that as our understanding of the role of the circadian timing system in maintaining human health has rapidly evolved over the last few decades, we've also begun to understand that disruption of that system contributes to poor health. Now, as you've described, these manifestations of poor health are profound, right, in terms of, and far-reaching. They range from mental health, such as conditions like depression and other mood disorders, to cognitive disorders like dementia, to physical disorders such as cardiovascular disease and metabolic disorders, diabetes, increased risk of obesity, and also reproductive disturbances, gastrointestinal disturbances, cancers. The effects of circadian disruption are really far-reaching. Now, one of the mechanisms that causes circadian rhythm disruption, as we've been talking about, is inappropriate light exposure. Adverse light exposure at particular times of the day when the system can become disrupted. Because, of course, we know that our system has evolved at a time when electric lights and artificial lights had not been developed, right? So we had a solar light dark cycle. Suddenly there was the advent of electricity and artificial lighting. And artificial lighting has presented a major biological challenge for this system that is not ready for exposure to light, for example, in the night. And that we now know is contributing significantly to circadian rhythm disruption on a day-to-day level. And we know that circadian rhythm disruption increases the risk of a number of these conditions.
This episode is one of hundreds of informative and free clinical podcasts from Health Ed. Access the entire library through the Health Ed app for healthcare professionals, which you can download today from the App Store.
I'm getting very concerned because nobody talks about the manipulation of light when we are dealing with all these incredible diseases that we see all around us. And yet it sounds like it's something very important. So these sorts of interviews are fabulous. But having said that, you did mention the proliferation of different types of goggles and blue light goggles and blue light blocking glasses. Are they just money spinners, or do any of these help? And if they do, whom would they be helpful to?
All of these could play an important part in our strategy to try and optimize and manage our light exposure. So let me give you some examples. We know that evening light exposure may be potentially contributing to delaying the circadian clock of some people who are particularly sensitive to light, which causes them to experience difficulty falling asleep. And they may even develop that condition I referred to, delayed sleep-wake phase disorder. Now, therefore, to protect against that exposure to light and minimize the exposure to light, you could try a few strategies. You could reduce the indoor lighting, you could reduce its intensity, You could reduce the short wavelength composition, the blue composition. You could do that using the, manipulating the actual light source itself, or you could shield the eyes from the light source. And so one way to do that is to get goggles, glasses, that some of them are preferentially filtering out the shorter wavelengths of light. And that, in a way, in an attempt to protect the circadian system from these wavelengths that the system is maximally sensitive to. The other approach, of course, is to filter directly the light source. So we have now a proliferation of light-emitting devices that we're all hooked onto. Those provide exposure to significant levels of light, and we know that those electronic devices are coming with filters that can filter out the intensity of light, the colors of light, by going into night mode, for example. So there's a number of strategies, but what I would argue, David, is that a certain literacy in the community, you referred to earlier, that we don't hear much about this. And that is a challenge, because what do people buy? How do people use glasses or night mode on their devices? Or when they go into the hardware store, what bulb do I choose? LED source do I choose for my indoor environment? All of that is going to require an increased light and circadian literacy in the community. So we need to do a lot more public awareness and education. And secondly, we need to ensure that we provide clear guidance on how to effectively manipulate the light environment to optimize health.
I would love a time when you are actually able to reach not just all health professionals, but really the whole Australian community. Because when I listen to you speaking about the importance of this topic and how it impacts our health and how little we're doing about it, it's really like driving a car without the seatbelt, isn't it?
David, I think it's a critical area for healthcare professionals. We need to start with healthcare professionals. So that's why I'm delighted to be doing this podcast with you. Healthcare professionals can recognize the opportunities in improving the lives of patients through understanding the circadian system. And let me share with you just the framework. By measuring the clock and understanding how to measure this circadian clock, we can better understand the cause of diseases that are facing our patients. And we can, number two, target the clock to be able to reverse that disruption or correct that disruption. And number three, we can exploit the clock. That is, that we know that at certain times of the day, the clock may be regulating a particular physiological process that, for example, in our immune function or in our metabolic function, in which certain medicines, for example, may be more effective than at other times of the day. And therefore, it really sets the groundwork for a new paradigm in medicine and in healthcare, where healthcare practitioners understand the power of this circadian system, the reasons why we would measure, target, and exploit the circadian clock.
I would like to say that all we ever understand is the use of melatonin in trying to reverse the disruption or do something to the circadian rhythm, but that is about all we know.
In terms of tools to manipulate the circadian clock, yes, you're right. There is a limited number of tools that have gone through rigorous testing at the level that we would be able to, as healthcare providers, be able to recommend treatments. As you described, we've known for a number of years, melatonin. It was actually, David, the discovery was in Australia at La Trobe University that demonstrated in 1983, much to people's shock, that this hormone melatonin could shift the timing of the central circadian clock in a mammalian model. It was demonstrated first in rats, and then it was followed quickly in the UK by a demonstration in humans that you can manipulate the timing of the brain circadian clock using melatonin. That led to a proliferation in the use of melatonin as the treatment of choice for circadian rhythm disorders. But of course, we also know that light is the most powerful manipulator of circadian clocks. So by increasing our understanding of the way in which light affects the clock, the timing of light, the color properties, the intensity, all of these things will be able to deliver light more effectively as a treatment. And at the moment, there are trials that are ongoing of drugs that will also target the circadian clock. And so there will be a time where we'll have many more pharmacological tools that will be available to us to manipulate the circadian clock as well.
I'm just envisioning, Shantha, this special pair of goggles that will alternately either block up the blue light at the right time, switch on the blue light at the right time, become a little bit warmer and a little bit less intense at the right time. And if you want to boost your immune system or whatever, it switches to a different color. Can you ever imagine that we would have goggles like that? Or could it be even useful?
David, I think that the way of the future in managing circadian rhythm disturbances is going to call for a combination of behavioral strategies, so tools that will support us in altering our behaviors. So you just talked about goggles. It could be goggles, it could be mobile phone applications, it could be light sensors that we are, utilizing that give us a program of the appropriate and optimal timing and exposure to light. But it may be combined in some cases with pharmacological interventions as well. And that would be the ideal management approach, in fact, for patients that have disrupted circadian rhythms, that we don't want to just do pharmacological management because we know that behavior and light-dark exposure and all of these factors play a critical role as well. So we want tools that bring all of these things together, and a digital platform that combines all of these things using all the kind of advances we have in artificial intelligence, for example, that will be able to learn behaviors and give us a program of the appropriate time for taking particular interventions, monitoring light exposure, giving us light guidance, will all be the way of the future, I think.
Until you've taken us, at least you've taken me to a different level of thinking. But I'd just like to close with groups of people who are at particular risk, who need help. And currently, we don't seem to be able to know how really to help them. And I'm referring to shift workers, pilots, and other people who really have to work odd hours. How can we help them? And what may be something coming, or if you like, in the near future that could be of use?
So, David, shift workers are a population that have high risk of circadian rhythm disruption combined with inadequate sleep and poor sleep quality. So they have the triple whammy, if you like, of circadian disruption, sleep deprivation, and poor quality sleep. Now, considering that, in the Australian population, for example, we estimate that about 17% of the population works some form of shift work. And after the pandemic, it may be greater because of flexible work arrangements and so on. Given this, we should be doing much, much more to support this part of the workforce. For example, we know that a number of them are involved in critical services, in healthcare, in emergency services, as first responders and so on. We also know that these populations are extremely vulnerable to a number of these adverse health consequences we've been talking about: cardiovascular disease, depression, anxiety, stress, burnout. So absolutely, we need to deliver focused programs of work to support these workers. And in short, it needs to be at multiple levels. When we talk about shift work, we need to firstly increase education among shift workers. Secondly, we need to ensure that the rostering systems that shift workers utilize are minimizing the risk of circadian disruption, sleep deprivation, and poor quality sleep. Thirdly, we can harness the information we know about light and its beneficial effects and its deleterious effects. So we need to design the environment effectively. And then the fourth part is around managing sleep disorders. We know that shift workers carry a high risk of sleep disorders, and those remain largely undiagnosed and untreated. So therefore, the fourth element is providing shift workers with access to healthcare that will be able to help them to readily manage their sleep disorder risk. So my wish is that Australia will become a leading nation in recognising that in order to address this growing problem of chronic diseases and so on, particularly among areas of the population that engage in shift work, we should implement programs of work like this.
Such an incredible thought, and such important people, because as you said, first responders, healthcare workers, all our supply chain, all of these happen at night. And these poor people, they are actually sacrificing themselves for our benefit. And we don't really know how to care for them well enough.
Absolutely. And I think the time will come where not only will the shift workers demand that there is adequate investment in protecting their health, safety, and productivity, but also the people that they are serving in the community will also expect that we as a society will protect them as well. Because, of course, the safety risks and all of these things flow on to impact people all around in the community, the patients, the people driving on the roads, that people at all stages of a supply chain are all impacted by these problems that shift workers pose, or shift work poses. And so therefore, if we fix the underlying problems that we understand now through our advances in health and medical research, we can really significantly alleviate the flow-on effects.
I have one comment, and then I'll ask you for your key messages to our listeners, because what I'm really looking at, Shantha, is probably, you mentioned, an app and likely a little sensor or device that I can clip onto something, so that when I go it will tell me when I should go for a walk. And when I'm going for a walk, because, some days it's really bright and other days it's very overcast, it will inform me when sufficient light exposure has been had, and then it'll tell me, look, go and have a rest, go and do it whatever you want. And then at night, it will inform me to start turning my phone to night mode and my lights down. Is there something like that going to happen? Because we have absolutely no guidance. We don't know what to do. And when we go for a walk, we have no idea what's adequate and what's inadequate. We need help.
We do, David, and there are certainly plenty of devices, apps, monitoring tools available. What we now need is to take those into what researchers like me call implementation trials, where you want to ensure that the tools, the technologies, the measuring capabilities that you're providing individuals with are going to be implemented in such a way that they actually drive behaviour change. Because, of course, in all areas of health, we know that you can provide people with all the tools in the world, but how do you get them to actually change their behaviour? And we know in other areas of lifestyle medicine, for example, in physical activity and nutrition, that has been a major challenge. You can measure the macronutrient contents of food, you can provide guidance, you can track steps, all of those things, but to shift behaviour is a major undertaking. And so we need to invest a lot more resources, as you said, in taking all of those available monitoring tools that have been discovered and are in the market and implementing them in a way that is going to drive behaviour change.
Dr. Shantha, that was a most intriguing interview. I am sure I will want to speak with you again more about the manipulation and use of all the knowledge that you have, but you've given us a very good overview of how important this topic is for all of us. Because when you speak about looking after the health of our patients, I'm actually thinking about looking after the health of the health carers themselves, because we might not do the right thing. So it's over to you to give us some key messages and to summarize this very important topic.
So the first key message is that as organisms, we have evolved over millions of years to have this finely tuned circadian timing system that regulates multiple aspects of our physiology and our behavior and ensures fundamentally that all physiological processes occur at the appropriate time and in sync with one another and with the external environment. As humans, we have come along and imposed a number of disruptions to that system. And that has resulted in increased risk of a number of chronic medical conditions. Recognizing that, understanding that is the first step. The second thing to think about as healthcare providers is the opportunity that we now have available to us for a new approach in healthcare, where we harness the power of circadian timing, where we develop tools that help us to measure and assess circadian timing well, so that we can target the clock and we can correct the disruption that is taking place on a daily basis, and we can exploit the clock to improve the health outcomes of our patients. And David, as you said, it's critically important that we look after each other as well. And the way that we look after each other is by ensuring that we have the best possible resources available to ensure that our work is as safe and effective as possible, so that we improve the quality of the care that we're providing and also protect ourselves in the process. And this is, I think, another tremendous opportunity that we have in being able to utilize the circadian system, understand its properties, and implement evidence-based interventions.
Shantha, thank you for a most informative interview.
Thank you, David.
Thank you for listening. Visit healthed.com.au to create a free account and claim CPD for podcasts like this and access a record of your learning. Subscribe to the show on Spotify or Apple Podcasts for weekly episodes on a range of clinical areas relevant to your ongoing practice.